Sorry. Thank you so much. I'll jump in quickly. As you all know, we reopened to the public City Hall just yesterday. I think we had a dozen or so visitors the first day. I haven't heard the count today. It's gone smoothly. We've kept people in the lobby. There are people who, despite our encouragement to continue to do as much work as you can or contact as you can by phone or by web, there are people coming in. We're providing masks, and from what I understand, it's gone smoothly, and just wanted you to know that we continue to, of course, provide services as we have throughout the whole thing through the city. Continuity of city government is still active, and they are monitoring carefully all the conditions and protocols for all of our workforce. I'll just remind you, we've had 2 employees who were infected, positive diagnoses of COVID. That was many weeks ago, and we've had none since then. We're very pleased with that as our employees continue to take care and provide services 24/7. And we're very pleased that we haven't had any more confirmed cases. You will expect this week, probably tomorrow, the county health officer, Dr. Sharp, to report the plans for the upcoming stage or phase, if you will. Our order locally extends to the 15th, so we look forward to that. I continue to collaborate closely with them. We are not in synchrony exactly with the state, but I think that's very appropriate. I think we're being very prudent. In fact, I'm encouraging that we continue to be prudent moving forward. The health indicators are good. I wanted to let the public know. You'll hear that from many sources, but the hospitalization numbers and the incidence of disease by all those who are being tested is quite low in our county relative to the rest of the state, so that's all good. We have a new test site in town and new tracing capacities, which are all important to do that. I, as I mentioned tonight, still concerned about the pace. You can see I did give a speech virtually last week. If anybody wants to see the 10 tough weeks, just reminding us it's been a little over 10 weeks now since the pandemic was declared. It sometimes feels like 10 months or longer, but in those remarks, really thank the community, so many people in the community, so many institutions that have helped make things go smoothly to avoid a crisis in our healthcare system, to continue to tamp down the spread, and our behavior is what drives the future behavior that will be allowed to do by the health reality. So I appreciate everybody doing that, masking, physical distance. If you're home and sick, feeling sick, don't go to work and get tested, those kinds of things. And if you want to look at that speech, that'll give you a lot more detail than I'll do tonight. Let me finish just by saying we're going to shift, of course, to the 2 work groups, which I often do. Again, thanks to them. They're wonderful commitments from around the community, individuals, extraordinary efforts and accomplishments you'll hear about tonight. I want to express my thanks to them. First, you'll hear a short update from the Economic Stabilization and Recovery Group with the focus on the arts nonprofits that we've been doing lately. You'll hear from Director of the Arts, Sean Starwitz from the ESD department. And then the bulk of our presentation, about 10 minutes, I hope, tonight, will be from the Social Services Work Group, coordinated with Beverly, Calender-Anderson, and several really strong and incredibly committed philanthropic leaders who are going to talk about what they've done with the community together we've done, and also some recommendations going forward. So without further ado, I'll hand it to them. Thank you for the time, and I think we'll all be available for questions at the close of this report.
Who's next? Who will start?
I'll go to Alex Crowley, I think, to introduce Sean.
Yep. So thanks, Mayor Hamilton, and thanks to the council for having us again to report out. I'd like to start by just reiterating our ongoing thanks to the Economic Stabilization Recovery Group, especially to Council Member Scambolari for her involvement. So what I will just very briefly cover here is that you'll see on this slide, you've received all this information. What we are doing is moving approved loans into the funded column, so the aggregate number has not changed week over week, but you'll see that shift happening. And also I will be doing more demographic breakouts bi-weekly rather than every week, because they don't change that much. So this is a more sort of direct focus on the funding side of things. I'd like to turn it over to Sean Starowitz from ESD to talk about the Bloomington Arts Commission and BUEA grant work, and really to help highlight the importance of the arts to Bloomington, and he can talk you through some of the details. So I'll turn it over to Sean right now.
Yes, excuse me. Good evening. It's a pleasure to be here in front of council again and to give you guys this, give you all this update. So just, as I'm part of the ESR working group and have been really focused on, the COVID-19 impacts on the arts and culture sector. So tonight's presentation is a mix representing, efforts by the BUEA, the Bloomington Entertainment and Arts District, known as the BEAD, and the Bloomington Arts Commission. In early or late March, we did a significant survey of the impact of COVID-19 on the arts community, and it was broken down. We had about 192 respondents, and it was kind of broken down into a couple different things of independent contractor, for-profit, and nonprofit. And this is just a few snapshots of kind of the major impact of COVID-19, both in the short term and in the long term, looking at the full 2020 calendar. If you look at cancelizations and postponement to, canceled workshops, and this impacts both individual artists, this impacts theater, this impacts, the venues, all the kind of creative sector that kind of gives the cultural vitality and the cultural vibrancy that Bloomington is known for. 76% of nonprofits had to refund tickets, which is a huge blow on cash reserves for a lot of these organizations. 50%, as they are all shifting to new business models, seeing a new online presence, that possibly means hiring of new people or restructuring their whole entire programs. I know a few organizations known as, Bloomington Film and Theater Academy have started to do online workshops. So just like any industry, the arts and culture industry has been significantly reshifting its business model to be responsive. A pretty alarming number, though, in terms of the nonprofit sector was the 88% reduction in staff. That's not of any surprise, but is a huge loss of employment in the community by our many arts and cultural nonprofits. And then this is just a national snapshot of kind of where so I wanted to start at the local level and kind of show where we are nationally. So this was provided by Americans for the Arts. This has been an ongoing survey that we've been involved in, but nearly $5 billion in losses in the economic sector. 94% showed canceled events. More than 33% had to dip into their financial reserves. We were on that same level of impact for our local nonprofits in terms of arts and culture and dipping into their financial reserves. So it's pretty challenging, time for the arts, especially because most of them will not be able to open until phase 4 based off the state of Indiana recommendations, which is well into July. So that's a long time to go dark. And a lot of our arts and cultural spaces are not feeling comfortable even beyond that, and whether donors feel comfortable. So what we were able to do through the BUEA and through the Bloomington Arts Commission is we restructured our grant program to be only operational support grants. So we were able to combine, thankfully, thanks to the mayor and you all, last year, we were able to increase our arts grant program to $40,000, and we matched that with the Bloomington Urban Enterprise Association to approximately give out $80,000 in operational support grants. So traditionally, grant programs are project-based, and this time we felt that that was not necessary just because we didn't know how long shelter at home was going to take place, and in times of kind of uncertainty around public health, it's not professional enough for us to ask arts organizations to come up with projects, even though they may be able to do that online and whatnot. So we were able to, based off of this survey results, feeling the kind of negative loss of the connection to community, and then also, the fact that a lot of these organizations have been building and working towards something and to kind of have the carpet pulled out from under them, we were able to give out $80,000. So this was a joint effort. We had members from the BUEA, members from the BAC, a few members from the public that were on the review panel for us. And all of these organizations were based off of artistic quality, impact to COVID-19 on their organization. It was also weighted based off of operational budget size, so whether they had full-time employees, part-time employees. One of the things that we were really concerned with from the Bloomington Arts Commission perspective is that too big to fail is really important, but also too small to fail. So those organizations that are volunteer-based, that might be a 10,000 operational budget size, but is very impactful in the community, is really important. Those theater groups, those choir chamber groups, the variety of those organizations that provide a rich tapestry of programming throughout the year, we felt also needed support. And so this is kind of just a snapshot overall spread of who received funding. And this is also based off of organizations that support other artists, like Artists in Alley, has about 20 artist studios. The Buskirk Chumley is a huge impact and resource for artists all across the community. Lotus, as well as Reimagining Opera for Kids, Stages Bloomington, which is fostering the next generation of theater goers and theater performers. So we were all pretty happy with the overall spread of support that we have now. And based off of the work that the ESR working group has done, we also have an additional $100,000 that's allotted from the Bloomington Urban Enterprise Association later this year to distribute for operational and project support. So right now we're able to get this money out now to help organizations directly now, and then later as we slowly start to reopen, as spaces start to feel comfortable or organizations start to help out, we'll be able to support them. So that's it on my presentation, and I believe Beverly Calender-Anderson's up next.
Yeah, this is Andrew from the mayor's office. Beverly just texted me. Her computer froze up, so she's logging back in as I speak.
I can do a quick introduction as she gets back on. I'm not sure exactly what Beverly was going to say, but I know she was going to hand off most of this to the leadership, some of whom are with us from the social services working group, which has done really exceptional work helping coordinate so much good work that was going on, and they've assembled it together and coordinated. Thank you so much for that. And I don't know who's taking it up first. You got Tina, John, and Efrat, you all here, right? Why don't you guys go ahead, and Beverly can clean up and as needed. But thank you so much for being here and all you've done.
Thank you. Thanks. We really appreciate the opportunity to be here tonight. It just seems like yesterday, doesn't it, Mayor Hamilton, that you reached out to a group of us, myself from the Community Foundation, Tina Peterson, John Barada from the Bloomington Health Foundation, Diane Buzzell from the IU Health Foundation, Efrat, Feferman from United Way, and Dan Smith from the IU Foundation. And he asked us really to work together collaboratively, because this is what we do, right? We support local nonprofits in really fulfilling their mission each and every day. But in this particular situation, how might we work with our local nonprofits to gain an understanding of how we are going to secure the safety net for our community during a time of crisis? How are we going to make sure that it continues to hold, but also is pliable enough to respond in a very rapidly evolving situation? So we were invited to think about what are the resources and the supports and potentially the funding that would be needed to support the broader community in addressing these challenges that we are facing in the areas of shelter, food, childcare for essential workers, and health and personal safety. And so over the course of the last roughly 8 weeks, we have been convening groups of stakeholders, diverse groups of stakeholders in each of these areas, trying to understand what are the problems that we're facing, what are the challenges we need to address, where are gaps, what are the potential solutions, and what are the strategies we should be thinking about advancing as a community. I will tell you that our work is not yet complete, but we do have, we have completed the process of really working with each of our groups of key organizations to understand where are we today, what did we need to accomplish immediately, many of those things that have been taken care of, and then what's the future need to look like if we're going to continue to weather the challenges ahead, and to be prepared should we have this kind of challenge ever again in the future. And so we would like to just share with you one by one some of the learnings that we've had by working with community stakeholders. And I think we're going to begin tonight with Efrat talking about shelter.
Thank you, Tina. And yeah, thank you for this opportunity to serve. Jim Sims, nice t-shirt, wanted to mention that. I had the opportunity to work with our shelter and transitional housing providers who really were on this in terms of seeing the concerns that they were going to be facing, because if you think about a shelter environment, they are not set up for physical distancing. And then the concern was, what happens if someone is showing symptoms of COVID-19 or anything else, really? Where do you safely house someone? And I really want to acknowledge, in particular, Forrest Gilmore from Shalom and Emily Pike from New Hope, Dana Jones from Wheeler Missions, and Deborah Morrow from Middle Way House. Because as we were sort of getting organized, they were already kind of starting to pull some things together with the help of city, department heads, as well as the county health department. And so really, this is back in March, and what's been accomplished, I think you're aware of, that an isolation shelter was mobilized so that anyone experiencing homelessness and showing symptoms could go isolate in a safe, supported place. But then also out of the work that this group did, and many others joined us in a couple of meetings, all stakeholders in this space, the next sort of recommendations that came out of there that were implemented were within each shelter or transitional housing facility to distance people, to reconfigure their spaces and set up protocols for screening, set up hygiene and cleaning practices and all of that. A need for hand washing stations and porta potties in key locations was identified, especially as the day center at Shalom closed or limited its services, and these have gone up in a couple of places. And I think while this is just anecdotal, there's only been one reported case among our shelter guests in our area. We have 380 people that we count as homeless in our community, and about 320 that utilize our shelters. And so, to have, knock on wood, mitigated anything, further widespread, I like to think can be attributed to this early, proactive approach by our community. So the recovery site, the isolation site, which now has been the beneficiary of some increased state funding. The United Way had given $70,000 initially to launch that, but then the state came in. I'm sure Beverly can provide additional details, but it's still in operation, has only seen the one guest who's positive, but has averaged about one guest a week. And so now they're in the process of scaling it back to save a little money on the hotel rental. No need for an entire hotel, but we wanted to be prepared, and we were. So appreciate, your investment of both dollars and time and coordination and support from different department heads. Chief Moore was really involved and continues to be, and Beverly's just been stellar in taking all of this on. And of course, Mayor Hamilton and Council appreciate all of your leadership on this. I'll pass it on to John.
Thanks, Efrat, and good evening, Mayor Hamilton, council members, and guests. Thanks for the opportunity to be here. John Barada, President and CEO of the Bloomington Health Foundation. We're honored to be part of this group. We rolled our sleeves up aside with our friends and got to work pretty quickly. BHF, we really dove into the food emergency system, and understanding a community's reliance on emergency food systems is, needless to say, complicated under normal circumstance, let alone in the face of the COVID-19 pandemic. Our community's emergency food system relies on many different local organizations that actively coordinate a complex mix of state and federal assistance programs, school children food assistance programs, a regional network of food banks, local food pantries, volunteer delivery systems, community food and financial donations, and on and on. And largely that work is done in harmony, and broadly speaking, the sector has successfully reduced food insecurity in our community. It would be remiss to not say that undergirding that system is a team of highly motivated nonprofit leaders like Julio Alonso at the Hoosier Hills Food Bank, like Amanda Nickey at Mother Hubbard's Cupboard, like Cindy Chavez at Pantry 279, like Vicki Pierce at the Community Kitchen. And those people really, their commitment and passion to their organization missions is really nothing short of inspirational, and their ability to adapt, innovate, problem solve, and to simply get the job done should not be underestimated. And I'll go through some of the recommendations that we made and some of the assessment, but we conducted probably over 25 hours of interviews with private sector folks like Jeff Meese at One World Enterprise, to Hattie Johnson at MCCSC Food Services, to Vicki Coffey at RBB Food Services, to our nonprofit leaders, in addition to many, many others. And while some of the identified barriers that we identify in our white paper are easily remedied, and others will require a sustained community commitment, there were three really pressing concerns that we felt needed to be prioritized and addressed by a well-resourced, coordinated community-wide effort. The first priority was fundamentally, and I was sharing these with my wife not too long ago, and she just kind of said, well, those seem pretty obvious, John. So a lot of work to get at some really fundamental recommendations. But number one is we have to ensure that our Hoosier Hills Food Bank, our region's only food bank, maintains the flexibility to purchase food. And we've been able to do that with the partnership through the United Way and the Lilly Endowment funds and other resources to really make sure that our Hoosier Hills Food Bank, which provides so much of the food to our pantries and our other retail distribution points, really maintains the flexibility to acquire what is called purchased food. And we've been able to successfully do that in partnership with the Hoosier Hills Food Bank really through fall. We've been monitoring supply and demand, and we get weekly updates. And there were some tense moments there, I have to be honest. There were some really tense moments as demand was increasing, and there was a lot of concern around supply chain and orders being canceled and not being able to fulfill the orders in the time that we would normally expect. We feel good right now. We are maintaining a line of sight, and I'll touch on that in just a second. So number one, ensure our food bank maintains the flexibility to purchase food. The second recommendation is to really make sure that our area's leading food pantries, school feeding programs, kitchens, and delivery services simply remain open and operational. We talk about essential workers. If there ever was the definition of essential worker, I like to nominate the staffs of Mother Hubbard's Cupboard and Pantry 279 and the Hoosier Hills Food Bank, who were working in really stressed ecosystems with a reduction in volunteers, oftentimes on really skeleton crews adhering to new models of operation, adhering to new protocols with personal safety equipment. And again, there were some moments of pretty intense stress for our pantries in making sure that they had just the simple capacity to stay open. If our food bank is supplying food, but there's no one there to distribute it to the literally lines of cars that are lining up and continue to line up at our food pantries, then, well, we haven't really got much of a distribution system. And so we've been able to do that again with the support of the United Way and the Lilly Endowment funding that's been able to be directed to make sure that our pantries stay open and operational, that they were supplied with the appropriate PPE that they needed. And I know some of our pantries now are operating with some paid staff for the very first time in their organization's history, which is a great asset for our community. The third recommendation from the food subgroup was really around initiating an aggressive community-wide campaign to enroll those who qualify but are not yet registered for the Supplemental Nutrition Assistance Program, or SNAP, or food stamps for those that might not be familiar with the term SNAP. And so while we are very sober about the ability of SNAP to provide 100% of a family's food needs, it is a very critical piece of their food security puzzle. And so we've been partnering at the Health Foundation over the last several weeks with Lucy Shake from the Bloomington Volunteer Network, with the City of Bloomington, with Amy O'Brien, with the Covering Kids and Families team at SCAP, the South Central Area Action Agency program, and with all of our food distributors to develop materials both in English and in Spanish, and to do flyers and outreach at these points of distribution to engage and encourage people to call Amy O'Brien, who's a trained navigator both in Healthy Indiana Plan 2.0 and SNAP benefits, to really make sure that those who qualify are able to sign up for SNAP benefits. The more people we can have being eligible and accessing SNAP benefits will reduce the pressure on the emergency food system in our community. We're very proud of the work. I'm just hearing anecdotally from Amy that she's already been getting phone calls from people who are looking for individual navigation to help with what can be sometimes a little bit of an overwhelming, intimidating application process. So the idea that we have real human beings who are standing by, if you will, to take the phone call of those who need help getting enrolled is a real testament to our community. Moving forward, we also have convened our Food Security Council, and now we do have an ongoing group who meets with the Food Collaborative, and we're meeting every week, and we're sharing information, we're tracking supply, we're tracking demand, so we can literally start to create a trend line so that we do not want to be caught proverbially with, unawares that, our food bank or our food pantry are on the knife's edge of either closing or running out of food. So we now have a system in place to be able to track that supply relative to demand. And the group is really functioning well. And we continue to look for ways to collaborate and share resources. So again, hats off to all of really the frontline folks who do the hard work every day. And from the Bloomington Health Foundation's perspective, we've been really humbled and honored to be a small part in helping bring that group together and help them operate with a little bit more efficiency, knowing that their focus has been really on the day-to-day operations of their work. From there, I'd like to pass it on to the third area, Child Care for Essential Workers, which has been headlined by Tina Peterson and the Community Foundation. Tina?
There we go. I said thank you, John. It was a natural progression for the Community Foundation to focus on child care for essential workers. As many of you know, the Community Foundation has been supporting a program called Monroe Smart Start for many, many years, really focusing on ensuring we have access to quality early learning for children and the funding to support families to create those opportunities for children. In this particular instance, we are trying to respond rapidly to the need for those essential workers, so healthcare workers, those in the medical space, including Catalent and Cook and others, Baxter, that needed to continue production of medical products, firefighters, first responders of all types, those working in pharmacies and grocery stores. And so really trying to determine how we are going to provide care for those essential workers while understanding the constraints that safety required at this point in time. We did some very initial survey work to determine what our needs were for childcare, and we very rapidly began trying to find the space and the facilities and the providers to serve about 250 children. And I cannot say enough about two entities, the Boys and Girls Club and Parks and Rec, Paula McDevitt and Becky really stepping up and developing what I think was an innovative approach to serving children, using a pod approach, right? No more than 8 to 10 children in a pod, and all the many steps that required in order to keep children and workers safe in a child care setting. And what exacerbated this challenge was that we generally, in March, April, and May, do not need to provide care day in and day out to children who are ages 6 to 12. So the closing of school created a challenge that we really never had to address before in the numbers that we needed to at this point in time. And so some solutions were identified. We had a real challenge finding workforce. We did a call out. We had a huge response from the community of people that were willing to come and work in childcare settings. We rolled them out, announced them. And I think just symptomatic of the ambiguity that we're all feeling about the current environment, we just did not have many families that felt comfortable to take advantage of the opportunity. Either they had already found a solution to their problem, they were fearful about their children being in any sort of group with others, or they quite honestly just could not afford what it costs to have that type of intense care for kids. That's really expensive model to deploy. And so we began really working one-on-one with families, trying to help them find the support they needed, if it was money, to find even in-home care, if they were just not comfortable putting their children in childcare settings. It was a huge learning experience about how we'd done a survey. These families had told us they needed the care, but yet when push came to shove, they really did not feel comfortable with their children being in a childcare setting. We continue now, that group continues to meet. We are looking at now what happens as employers are reopening, adding people back into their places of work, and how we're going to be prepared for that. I can tell you it continues to be a huge challenge. Number one, we do not know how many people are actually going back to work. It is very, many employers are calling people back slowly, and only those that are essential to be in their buildings it's very hard for a child care site to incur the expense to reopen if they do not have some guarantee about how many people they will be able to serve. These are organizations that run on very lean revenue models, and so I think we've all been surprised at the challenge that we've faced in a very ambiguous situation. I can tell you right now, the focus is really on summer camps. There are not going to be many of our summer camps. In March, we put out the big flyer that says these are all the places your children can go this summer. Only a very small number of them are reopening this summer. In fact, at the moment, it looks like 6 who will be able to serve 400 or 500 children. an incredibly small number when you think about the number of families that need to work right now and have care for their children. It just is not feasible for many of these folks to open. Some of that relates to the school system. They provided venture camps in the summer, yet they have not been given approval by the state to reopen their buildings. So that is not going to happen before July 1st. At that point in time, many families will have had to find other solutions for addressing their child care needs for the summer. The group is looking at how we are going to address what may be unique structures for school in the fall or August when school may begin. As many of you know, the school's looking at a reentry plan, and they have 7 different potential options they're exploring on what that would look like. Many of those do not include all of the children being in the building all the time. So once again, we may be at a full employment status, but not have full-time capacity for many children. And so we're now trying to look ahead, very hard to do without knowing exactly what the situation will be for our public school systems in the county in the coming school year. And so I will tell you that there are some that we currently are seeing some of our child care facilities begin to close. Currently in the state of Indiana, 1,600 early care birth to 5 sites have closed. In our community, we've lost 2 centers and 2 family child care homes permanently. Many of them not sure that they're going to be able to open in the long term. Right now, we have 13 high-quality sites operating, 6 more they're going to open in June, and this is for early care. That is just a fraction of the number of sites that we generally see providing early care. There has been some state assistance to support early care providers and child care providers. Certainly, both the Office of Early Child Care and Out-of-School Learning has provided some funding to compensate early care and other providers for the loss of families during this period of time, but that's discontinuing next week. And Early Learning Indiana is putting some funding out there, $15.7 million, to support what's called Come Back Stronger. So to cover expenses for safely operating in this new environment. But I think that the challenges are going to continue to be severe. There is some potential legislation, right? The CARES Act is looking at providing some funding for childcare. There's an advocacy effort by the United Way worldwide at the moment to try to increase the amount of that funding to $50 billion from the $7 billion that's currently in that. It would be supposedly distributed per capita. And so our community, for instance, if they put $50 billion into that bill, then Monroe County would see $2.2 million for support of childcare. So I wish I could tell you that we had a lot of solutions right now for childcare. We don't. It's an evolving situation that I think we continue to meet weekly and to determine how we are going to address a problem that doesn't have perfect solutions right now. And then I'll just transition quickly. The fourth and final group is the one that we just finished working with most recently, and that is health and personal safety. And Efrat, John, and I shared the responsibility for convening a large cross-sector of folks in the areas of personal health, public health, mental health, addiction recovery, domestic violence, and serving those with disabilities or other issues of personal safety. As you can imagine, this was a group that's facing a great deal of challenge because the demand for their services are growing so significantly during this time. I'll just, as an overarching message, there were many tactical solutions that were identified in each of these areas, and a great deal of collaborative spirit getting these groups of folks together. But the number one challenge that we identified for this, for health and personal safety, had to do with community infrastructure, and feeling that we really lacked some of the infrastructure that would help us serve our these populations of folks anytime, but especially during a time of crisis. And for example, just really quickly, I will mention two things: that getting the word out, right? Just the idea of messaging about some of the critical issues around mental health and addictions and recovery and substance misuse. We just don't have countywide vehicles really to get that information out in a really systematic way. Not having television stations, having a limited print, we found that we really need to develop a strategy as a community for advancing messaging in a collaborative and cohesive way. The second one was around policy and advocacy, and in our work we identified a number of areas where that advocacy is going to be needed at the state and the federal level, and how might we develop a more aligned strategy among all of our organizations for advancing what are critical issues for our particular community. Two examples of really infrastructure that's lacking as we address some of the larger issues in this area. And then finally, you can't talk about infrastructure without talking about broadband. And while I think we all knew that broadband was a significant challenge in education right now, and in people that need to work, for people that need to work from home, it is a huge challenge for those serving people in the space of health and personal safety. If you cannot access services, if you cannot reach out to your clients, if you cannot apply for support, it becomes just a huge equity issue for families. And so finding a way to collaboratively come together, city, county, and anything in between and beyond, to think about how we ensure that we have broadband, internet, cell phone connectivity for especially families in need is critical at this point in time. And so one of our recommendations will be that we create a county-wide collaboration around addressing our broadband challenges. Efrat?
Go ahead, John. I think he's going to take it away and wrap it up.
Yeah, thank you, Efrat. So just finally, in summary, some other good recommendations there in that report that we could share with you in writing. We just want to let you know that we have some additional work to do. We're going to be discussing next steps and how we can make some recommendations, and how do we really create the continuity moving forward to really take the lessons that we've learned over the last couple of months and create some infrastructure to be able to better position the community moving forward. So thank you so much for the opportunity to be here tonight.
I just wanted to take a minute just to thank John and Efrat, Tina, Dan Smith, and Diane Buzzell. They have been really a pleasure to work with, and they talk about being humbled by this work, but they are inspiring as a team to work with. And so I really appreciate them and want to thank them for everything they put into this. And then I'll turn this back over to Mayor Hamilton.
Thank you so much. I'm going to be 20 seconds. We are so fortunate to have leaders like those you saw. They know so much. They're working so hard, collaborating together. And we know our Zoom array could be filled with scores of the frontline heroes that they described, and they're kind of here in their stead. They helped us be prepared. They helped us be prepared for very big challenges, and they are collaborating in new ways. The group you heard tonight and those they represent, collaborating to get us ready, recommend how we can be ready. I can't thank you enough. So thank you for giving us the time to do that. We'll open it up for questions.